Sleeping is one of those things where you have a huge variation depending on age. So you've got your newborns up until they're a few months old, and it's not unusual for those kids to sleep 23 out of a 24-hour day. So their sleep is interesting because they tend to be more disordered when they're talking about like sleep patterns. And so a lot of times I get parents that when babies get to a certain age, say around 6 months of age or so, they start asking me when should they sleep through the night. And so my answer is all the way up until about then, baby sleep patterns are disordered, at least their brain waves. Everyone's seen like the brain waves when it comes to sleep, REM sleep, delta sleep. Most people at their waves, or if you don't have a sleeping disorder, they're pretty stable. In children that age, their brain waves are doing all this sort of stuff, and so their sleep tends to be very disordered, and they can stay that way until they're probably closer to about 6 or 7 months old and about 17 to 18 pounds or so. Then their sleep patterns get a little bit more like an adult sleep pattern, and you can start working on trying to get them to sleep through the night. I think you can't ever start too early when it comes to a nice routine around bedtime. So you can start that off at birth. Most parents don't think about actually reading to their kids from the day that they're born, but reading is one of those things that has a great impact on lots of different things besides just helping out with your sleep routine at night. So I think that when babies are first born, they have fairly disordered sleep pattern, but they're pretty good about sleeping, and then they go through that period where parents have to actively work a little bit to try to get them to sleep through the night. Then the next time period where that becomes an issue is going to be around adolescence. Adolescents also develop very, very funny sleeping patterns. Their sleeping tends to be pretty disordered at that age. Their sleeping requirements are about 9 hours per night, but they tend to like to go to bed later. That's just the nature of the beast for an adolescent, and the problem is that they have to be up for school the following morning. So getting the 9 hours in is actually not as easy as it sounds, especially if in the face of activities, finishing up projects or assignments or homework at night. So we really encourage those kids to try to get that 9 hours of sleep, because we know that insufficient sleep at that age, obviously everybody knows it affects school performance. No question that it affects school performance, but a lot of things that people don't know that it can influence is actually poor sleep habits are associated with depression in adolescence. They're associated with obesity. They may actually be associated with other physical illnesses later in life, diabetes and other health problems.